Hello, everybody.
Hello.
Good afternoon.
Hi, Alison. Valerie again.
I'll just give a moment for everybody to join before we start. And we're so happy to see you all. Hi, Vicky. We would love for you to put the cameras on so that we can see your faces and say hello.
Real participants. Otherwise, we talking to the blank cameras all the time,
Hello, hello. It's very nice to see
Hello,
everybody.
Kiran. Hello, Sarah.
Okay, I think everybody is in. So welcome to the Association of Ayurvedic Professionals. And this is the fourth in this series of talks. It's called Ayurveda for All. And this talk will be given by today, or discussion will be given by Dr. Chithramala Dissanayaka. I hope, Dr. Chithramala, says your name correctly.
Yeah.
I have to pronounce the Sri Lankan names.
No, it's okay. That's correct.
Thank you. And she'll be talking about Panchakarma. Panchakarma as a form of purification and ultimately to boost the immunity. Many of you are already students or practitioners of Ayurveda, so you have already some insight into why ultimately Panchakarma is the boost for the immunity, but we hope to be having a much deeper understanding through Dr. Chithramala's talk. And I should also introduce, for there may be new friends who I'd like to welcome and just introduce ourselves. My name is Ajanta Kaza and I am the Secretary of the Association, and this is Dr. Deepika Rodrigo, who is the Chairwoman of the Association. And I'll also give...
I had to tell you before you start, Dr. Chithramala and me, we were in the same university, and Chithramala is 1 year senior to me, and Dr. Chithramala and me has a great friendship for years. We are very good friends, and same as she's a dean of the university at the moment, and the Kalni University, and I introduced the great friend and the colleague and then great teacher, Dr. Chithramala Dissanayaka. Yes.
Yes, and I just wanted to add, if any of you have seen the profile, the information we put on the flyers for this event, Dr. Chithramala, as Dr. Deepika said, is the Dean of the university, an international speaker. She has, like Dr. Deepika, 25 plus years of clinical experience as an Ayurvedic physician. And I discovered in my talks with Dr. Deepika and research, she's a prolific publisher of many scholarly articles, research publications and books, and is also specialist in Panchakarma and Abhyanga therapies. I'm sure there's a lot more to say, and I've seen some of the publications of fascinating, such a wide range of expertise residing in one person. So we want to say a very warm welcome to Dr. Chithramala.
So thank you, Dr. Deepika and Ajanta. So good afternoon to everyone and welcome you all to my presentation today. First of all, let me thank you all for coming to today's discussion, and my special thanks goes to Dr. Deepika Rodrigo and the organizer of this meeting for inviting me for the today lecture. So I think you all are keeping well, but as you know, we all are struggling with this pandemic situation to find the ways to make our lives better. So actually the discussion helps to get over this type of disorders and steer our lives towards the better path. So yes, I know we all can do it. Nothing is impossible. Let's try. So now I'm going to share my screen. So I think everybody can see the screen. Is it?
Yes.
Is it okay? Yeah. So have you ever heard how to maintain lifelong with help with Panchakarma? I'm sure you must be wondering how it happens. Actually, you might know Panchakarma measures, but you might have no clue how Panchakarma helps to boost your immune system and how improve your body strength, and then helps to slow down the aging process. So today I am going to talk about, I'm going to share some scientific evidence with you all to prove how Panchakarma therapy helps to improve our lifelong health. So then it would be great beneficial for you all to apply or practice this magical treatment to get rid of from several disorders and boosting your immune system to have better health. So now let's go. What are the learning outcomes of today's lecture? So at the end of this lecture, the participant should be able to explain the type of Shodhana procedures, I mean Panchakarma procedures according to the Ayurveda. Then describe the scientific basis of Panchakarma procedures. Then third, describe the benefits of using Panchakarma procedures to maintain the health. So these are the learning outcomes of today's lecture. So before we directly go to the talk about the Panchakarma, I would like to talk about what is the aim of our Ayurveda. So I think you all are aware about these things, but actually the final aim of our Ayurveda is to reach the moksha. But apart from moksha, if you don't want to go to the reach to the moksha, I know definitely you people are here to not to get the moksha, but to maintain the healthy living style. So we need to discuss those things, not to moksha. I think Dr. Deepika is very much know about the moksha and everything. So she will discuss later about the moksha. So better to discuss today about the health. So health, what do you mean by health? I think according to the WHO, you all know what is the meaning of definition of health. But actually, health is termed as a swastha in Ayurveda. Swastha. We use the word swastha in Ayurveda. Define the swastha is explained in according to Ayurveda, it defined as like this. Here sloka, there is a sloka part here. Samadosha, samagnischa, samadhatu, malakriya, prasanna atma indriya mana, sastha ityabhidiyate. Sorry. Swastha ityabhidiyate. This is the sloka part. We can get the definition as a swastha. So, in this diagram, you can see that the sastha is, what is the position of sastha? So what are the things to maintain this position? What are the things involving in this picture. So you can see Atma, Indriya, Manas. It's the lower part of the this diagram. Then next it comes to the Agni, then Doshas, another part Dhatu, and Malas. Among all those factors, Agni is the main triggering factor to control the health. You can see here. So in general, it can be considered as a biological fire. Agni can be considered as a biological fire. It makes all the digestion and metabolism in the body. So when Agni becomes weaker, a number of unwanted, unripe byproducts start to accumulate inside the body. Such products are called, according to Ayurveda, such products are called Ama Visha and act as a toxic substance inside the cell. Then what happened? Then cell starts to deteriorate day by day. Then next, let's come to the doshas. These doshas, major biological component of the living body, named Tridosha. So the entire body functions are explained in terms of three doshas. Actually, dosha has an inherent tendency to get vitiated due to our lifestyle, weak Agni. It may be accumulated mala inside the body. Those are the things helps to get vitiated doshas. So next one, we can see mala. There is a stone we call mala. When considering mala, mala is the waste product of digestion and metabolism, and it gives, remember, it gives media to excrete toxins from the body. Mala helps to give media to evacuate toxins from the body. So the proper excretion of the mala helps to control the level of accumulation of toxic product in the body. So apart from these factors, the health depend on Atma, Indriya, and Manas also. I'm not going to talk about these things because today we have to talk about the health and how we can maintain the health and how improve our immune system, all those things. So first, then the health, what is the meaning of health and how Ayurveda define health, and so what are the depending factors of the health and all those things. Now let's go. What is the way of health? What are the way of health management approach? So these there are three components we can describe. First one is restore and strengthen the digestive power, digestive fire. In Ayurveda, it's called Agni. Digestive fire. In Ayurveda, it's called Agni. So to maintain the health, we need to maintain the Agni. So second one, purification therapy. One word, purification therapy. In Ayurveda, it's called Shodhana therapy. So what we have to do, what we have to purify. So there is a word called mala. Previous slide, there is a word called mala. So these malas we have to purify. We have to evacuate from the body. So third one, pacifying treatment. So first we have to improve our digestive fire. Second, we have to evacuate our toxic products. Then third, we have to pacify the treatment. So for the pacify the treatment, we are applying Shamana Chikitsa, restore the imbalanced doshas. So day to day, when we are getting some ailments, so what we are doing, what we do, we get some decoction or a pills or something like that. So those are the pacifying treatment. But if you want to do the shodhana, that purification therapy, it is called Panchakarma therapy. So now let's see what do you mean by shodhana or a purification therapy. If the doshas are vitiated beyond the particular level, they give rise to various endotoxins, which have tendency to be accumulated in the minute channel. I think now you got the idea what is endotoxin. So these endotoxins, we call Ayurveda Ama Visha, are beyond the level of pacification, and hence they need to eliminated from the body through Shodhana therapy. So by using Shodhana therapy, we can eliminate these doshas, these malas. Actually, Ama Visha is the end product of digestion and metabolism. But the mala is give media to evacuate these toxins. I think you clear. So now let's see, what do you call mala? According to the Ayurveda, there are two types of mala, Sthula mala and Sukshma mala. Sthula mala means Sthula mala means purisha. That means we call stools. Then mutra, we call urine. Then sweda, these are the Sanskrit terms. So I think you people familiar. Is it so, Dr. Deepika?
Yes, yeah.
Okay.
Yeah, familiar.
So sweda means sweating. So those are the stula mala. And there is another type of mala we call sukshma mala. Those are sapta dhatu mala. Here I have mentioned that sloka also. If you want any reference to know about those things, I have mentioned the reference also. You can go through it. So now I just want you to compare these malas with modern system. So types of toxins, you may heard about the free radicals. So these are free radicals. Normally we know the free radicals helps to create the more diseases, means non-communicable, especially non-communicable diseases. So there are a number of free radicals, superoxide, hydrogen peroxide, hydroxyl radical, etc. So these are the free radicals. We can compare with Ama Visha. Those are somewhat similar, not completely similar, somewhat similar. So these are the things, these free radicals help to deteriorate the cell and create the non-communicable diseases. So likewise, Ayurveda also, these are the malas that gives the media to the Ama Visha, helps to create a lot of diseases. What do you call that? Pradoshaja roga. There are a number of diseases as mentioned in the text. So here also I have given some name of free radicals and how to create it. Maybe due to food or a behavioral pattern or environmental pollution, maybe the water pollution, air pollution, or soil pollution. That type of environmental factors may cause to create the free radicals. Then apart from these factors, another drugs, medicine, that the chemicals helps to create the free radicals. Then what else? The aging process also create the free radicals inside the body. So these are the free radicals helps to create the diseases. When it is go beyond the normal limit, it will helps to create the, it will damage to the cell wall. And after that, it affect to the whole system and create the diseases. So now let's see sites of the accumulation toxins. I mean here, toxins means it may be the armor visha, or according to the modern medicine, it may be free radicals. So that the free radicals or armor visha first attack to the biomolecular level. Then if it is go beyond that biomolecular level, then it attack to the cell wall, cellular level. Then next come to the systemic level. Then finally it come to the gross body level and affect the organ. You may remember Shadkriya Kala. So pathogenesis, according to the Ayurveda, the way of pathogenesis, Sanchaya, Prakopa, Prasara, Sthana Sanshaya, Vyakti, Veda. That is called pathogenesis in Ayurveda. That the terminology we use, Samprapti. So when, because of Nidana, these are the Nidanadi Karana. These are the causative factors: diet, behavior, environment. It may be the drugs mean medicine here. Then the natural aging process. When these causative factors get vitiated, then start accumulation of mala, armor visha, inside the body, inside the cell. Then it accumulate more than up to the level. That means sanchaya. We call, according to Ayurveda, we call sanchaya. Then it comes to the next level, prasara. When it comes to the prasara level, that means that malas come maximum level inside their own area. So then what happens? It goes out of the that cellular level. Maybe that their own place. So then sanchaya, prasara, sanchaya, prakopa, then prasara. Prasara means they ready to go beyond their level. So then when it comes to the weaker point, maybe joint places, or some tissues, or maybe some organ, it accumulates inside that weak area. So then what happens? Dosha get vitiated here, then disease can easily occur. So this is the pathogenesis of Ayurveda. It's called Samprapti. So when the process is finished, we can see number of diseases can appear. That means, according to the Ayurveda Ama Visha, according to the modern free radicals, there are a number of diseases can appear when it is go beyond the level of limit. This slide actually I give just to show if the free radicals get accumulated more than the normal limit, what happened to our body. The brain get affected, lung get affected, immune system, then what happened to the blood vessels, then skin, then eyes, multiple organ have involved to if the free radical is getting more than up to the level. So now let's see how to control this harmful effect. So according to the Ayurveda, first way of evacuate these toxins, or first way of control this harmful effect, stop causative factor, Nidana Parivarjana. In Ayurveda, we call Nidana Parivarjana. So first one is Nidana Parivarjana. Then second one, apply detoxification methods, because there are some toxins inside the body. We have to neutralize the toxins. Amavisha, we have to neutralize the Amavisha, or we have to control the Amavisha. So third, there are some Ama adhere to the cell wall. We can't just evacuate that toxic, that Amavisha. First, we have to liquefy the Amavisha. So then liquefy the toxins. Then when it is liquefied, we have to bring that liquefied doshas, liquefied toxins, that the distant end to the proximal end. That means maybe GIT tract, gastrointestinal tract, maybe the respiratory tract, whatever the main tracts, we have to bring that cellular level to the main tract. So that is called excretion toxic byproducts. So then finally, rejuvenation of the body tissues. Without excreting, we can't stop the treatment, because there are some damage can happen inside the body tissues. So we have to rejuvenate these body tissues. This is the process we have to apply to control harmful effect in the body. So now let's see what are the forms of waste products inside the body. So I say to you, there are a number of toxins can accumulate each and every cells. Some may accumulate inside the lung tissues, some may be in the gastrointestinal tract or a pancreas or liver tissues, or maybe a joint tissues like that. So if the toxins accumulate inside the gastrointestinal waste, Amavisha, I mean, so they can easily go through bowel depositor or a saliva. If the toxins in the bowel deposited, I mean stools, earlier I said that the toxin, that mala, I mean that stula mala or a purisha give media to evacuate the toxins. So then bowel deposited GIT waste products can evacuate through bowels or a saliva. Then the urine toxins, the kidney toxins, bladder toxins. So we can evacuate through urine. Then third, skin, the skin tissue, skin cells waste products can evacuate by sweating. Then there are some toxin byproducts we can see dissolve in the fat. Those called fat deposited can evacuate through burning fat. We call langana. When we are applying langana, we can evacuate, we can burn these toxins by applying langana therapy. Then the fifth one, blood waste. There are some toxins accumulate inside the blood vessels or a blood. It goes through the throughout the blood. So we have to remove blood, that the toxic blood, when it is go beyond the liver. There are some toxins, Amavisha, can accumulate in the mucosal layer also. Those are called mucosal deposited. It is in saliva, maybe the vaginal secretion or ear secretion. So those things also we have to evacuate. Then tears also. You may think no need to cry or no need to evacuate tears, but tears also give media to evacuate the toxins. Okay, so that's why it is the people who are having dry eye, it is not good to maintain the health, because tears give some media to evacuate the toxins. Even vaginal secretion, saliva, you may not think about those things, but Ayurveda has mentioned under the Saptadhatu Mala, it has mentioned we have to evacuate those. There are some toxins dissolved in these secretions. So we have to stimulate and evacuate these toxins by Shodhana Karma. So there are some gaseous toxins also. Carbon monoxide, carbon dioxide, ammonia, nitrogen, those are some toxic gases. But Ayurveda has explained, they are not giving carbon monoxide or carbon dioxide or ammonia like that. Okay, but they have explained what are the, there are some gaseous toxins inside the body. We have to practice, we have to purify the respiratory system, that the pranavaha srotas and all those srotas to evacuate the toxins. So this is the forms of waste products. If I summarize the forms of waste product, there are waste products, solid waste products and gaseous waste products, fat soluble waste products, and water soluble waste products. So there are four types of waste products. When it is water soluble, it helps to evacuate through urine or sweating. If the fat soluble waste product dissolve in the fat, we have to burn fat by Langana therapy to evacuate these toxins. So if there is in solid form, it easily dissolve in the bowel deposited, so we can evacuate through bowels. There are some water-soluble toxins. It dissolves in urine, maybe sweat or a saliva or a vaginal secretion. So we have to evacuate through those methods. So maybe by looking, you may think why we are sorry, there is a spelling mistake in why we are doing investigation. So maybe you think it is Western medicine or something like that. Actually, it is not a Western medicine, it's a scientific development. So I said that how to compare the toxins and according to the Ayurveda medicine and modern medicine, what are the toxins, and if we need to know, if we can use scientific methodology to identify, to evaluate the level of the toxin inside the body by using these investigations. So, but it depends on you. If you are practicing, if you are a good Ayurvedic physician, you need not to go through those things by touching pulse or by doing examination, that Ashtavidya Pariksha, Dasavidya Pariksha, you can do these things. But you can use these things when the patient come with these reports. You have to think what you can easily diagnose. Even you can easily correlate what is happened according to the Ayurveda, what is this and what we have to do, like that. So next, let's come to the interesting topic. So this is the topic we are going to discuss today. So Panchakarma, the word Panchakarma. There are 5 procedures. One call, we can call it Shodhana Karma also, but there are slight difference between Shodhana Karma and Panchakarma. When we read about more and more or think about more, then only you can find the difference between Shodhana Karma and Panchakarma, because Shodhana Karma means we are evacuating those toxins from the body. Panchakarma means there are 5 procedures. We can use Panchakarma not only for the Shodhana purpose, we can use these Panchakarma procedures for nourishing purposes also. That's why, that is the reason, the two difference of these words. So anyway, the Panchakarma means there are 5 types of Pancha means 5. Karma means therapeutic procedures. So 5 therapeutic, we are going to discuss these 5 therapeutic procedures. So first one is Vamana. Second one is Virechana, because it is difficult for me to give the picture how the Virechana Karma is going on. So that's why I just put this picture. So third one is Nasya Karma. Fourth one, again, very difficult to show you. So the fourth one is Vasti. Then the final one, the fifth one is Rakta Mokshana. Actually, here I have mentioned only leeches, but there it is more than there are any other methods also for the Rakta Mokshana. So later we can see. So now let's see utility of Panchakarma. What is the use of Panchakarma? I said the word Shodhana Karma is different from the Panchakarma. So here I am going to talk about the utility of Panchakarma. It can be used for the health prevention and also health promotion, and for the cure the diseases also. We can use Panchakarma for these 3 purposes. When it comes to the health prevention, Panchakarma in daily routine. We can use Panchakarma in daily routine. In our older people, they use Nasya treatment every day in the morning, because they need to stimulate respiratory system. So that's why every day they are using Nasya treatment. But when it comes to the Virechana, at least once in a month, once in 2 weeks, we use Virechana Karma to stimulate our GIT tract, gastrointestinal tract. Because otherwise the toxins or Ama Visha can accumulate in the tract. So when we stimulate the gastrointestinal tract, that the peristalsis movement get improved and get the proper digestion as well as proper evacuation of that mala. That's why nowadays, what is the big problem, big health issue? Constipation. So why constipation? Because we are not think about the GIT tract, or we are not think about the bowel habits. We are very worried about our time and we don't have that habit. So what happened? We are getting constipation. Constipation helps to create more and more disease nowadays. But earlier, the Ayurveda people not like that. They are practicing Virechana therapy to get stimulate the GIT tract. It's very simple. So likewise, the Panchakarma therapy we have to use as a daily routine. Then when it is come to the seasonal purification, elimination of dosha in different seasons. So Vata dosha normally aggravate Prokopa. Maybe in your area is different than this time duration. So anyhow, this is according to our country and India like that. So 1st of October to 1st of February, Sneha Sweda Vasti. Especially Vasti helps to evacuate Vata imbalance. So then when it comes to the Pitta, Pitta normally aggravate in June, July, October, like this, these months. So Virechana and Raktamokshana helps to evacuate the vitiated Pitta. When Kapha normally aggravated in February, April, June, like that, because that the allergies and everything normally rise in this that the asthmatic condition and everything going to get this season. So Vamana and Virechana helps to balance the Kapha dosha. So as a routine work, as a health prevention, we are applying Vamana, these Panchakarmas to prevention from the diseases. So then next, for the health promotion activity. For the health promotion activity, normally, as you are aware, that the chronic disorders that because of the accumulation of the toxins, ama, visha inside the body, according to the modern medicine, free radicals. So what we have to do nowadays also, what we have to do, we don't have good immune system. So if we have enough strength or a sound immune system, we can fight with those viruses, bacteria, and the free radicals, whatever the things. If we have enough strength to fight with those things, we are not getting diseases. Most of the chronic disorders due to our loss of immune system and loss of strength. So Panchakarma gives by using Panchakarma, we can strengthen our immune system as well as our Sharira Bala, strength. Even Rasayana therapy and Shamana therapy also helps to enhance our immune system and strength. Then when it comes to the therapeutic effect of Panchakarma, for GIT cleansing, that means if we want to remove ama visha, which are accumulating in the GIT system, if we want to cleanse the GIT system, we can use Vamana, Virechana, Vasti. Vamana for upper GIT tract cleansing, Virechana for middle part of the GIT, Vasti for lower part of the GIT tract. We can use to evacuate the toxin. When it comes to the respiratory cleansing and sinuses cleansing, we can use Nasya and Vamana Karma. We can use Nasya and Vamana Karma to evacuate respiratory cleanse, apply to clean the respiratory system and sinuses. Then kidney and bladder, uterus, we can use Uttaravasti. For the blood cleansing, we can use Raktamokshana and Virechana. When fat-soluble toxins, we can here one thing is missing, that the Langana therapy and Sehana therapy, because Snehana therapy helps to dissolve the fat-soluble toxins. Then the sweating, by using Swedana therapy and steam bath, we can evacuate the toxin. So according to the sites of accumulation dosas, we can mention Panchakarma procedures, we can mention like that. Head and neck, that means Urdhva Chatrukata Roga, we can use Nasya Karma. Then the blood disorders, we can use Rakta Mokshana. Then the upper GIT tract, we can use Vamana Karma for the Kapha Samana. And the duodenum, Virechana Karma, especially for Pitta dosha. Then the lower intestinal tract, for the Vata, we can use Vasti Karma. Now let's see method of application of Panchakarma. before applying the Panchakarma, we have to do Purvakarma. Purvakarma means Sneha and Sweda. After the Panchakarma, also we have to do Paschatkarma to get the maximum effect of Panchakarma. We have to follow these three procedures. This is the sloka for that. Sneha magre pravunjita tata sweda manantaram sneha swedopapanyasya sanshodhana matekare. That means first we need to apply sneha sweda to dissolve and get that cellular level doshas to main track. This is also why we need to apply Sneha Sweda. The sloka explain why we need to apply Sneha Sweda. I think Dr. Deepika may explain all these things. I heard she said to me, she has explained the slokas also. Bruddhi Vishandanat Pakat Shroto Mukha Vishodanat Shaka Mukta Malak Koshta Yanti Vayosha Nigraha. That means first we have to liquefy the doshas by using Snehan and Swedana. Then doshas have to we need to bring to the main track by using srotas. So that's why we are using Snehana Swedana therapy for this type of before the Panchakarma treatment. There are several types of Snehana Karma. One is called internal oleation method. Second one is called external oleation method. So before the Panchakarma, normally we used to give, we are using internal oleation. There are 4 types of internal oleation. I'm not going to talk about more and more these because this is a vast topic. I just give ideas so then you can go through the books and get the knowledge if you need. So normally we give cow's ghee or a sesame, and these are the main oleation, internal oleation medicine we use normally. Apart from these two, there is another two oleation method, vasa and majja. But basically we are using cow's ghee and sesame for the internal oleation. So apart from internal oleation, we can use external oleation methods. So we call bahira sneha. These are the oleation method to treat to head, to evacuate the toxin from the head. This is called pichu. This is called vasti, uro vasti, hrada vasti, kati vasti. Number of vasti we can use to evacuate the toxins. Then next come to the Swedana Karma. Swedana Karma, again, there are different types of Swedana Karma. If the patient is ready for Sarvanga Sweda, we can apply this box. Some patients we can't go for the Sarvanga Sweda because of skin disorders, maybe other several hypertension or whatever the things, may sometimes want to go for the Ekanga Sweda. So this is Ekanga Sweda, we call Nadi Sweda. This is Sarvanga Sweda. This is called Ruksha Sweda. This is called Snigdha Sweda. There are different type of Sweda Karma can use for the use before the Panchakarma. This is also Drava Sweda. There are several types of Sweda Karma. Just to give the idea, I put these diagrams. These are the modern equipments we can use for the Sweda Karma. But we not recommend these type of Svedana Karma. But if you people don't have enough that type of that wooden type equipment, so you can go for this also at least. Otherwise, you can't do that thing. So this is the Nasya Karma. Any medicine administration to nose to get desired therapeutic effect is known as Nasya Karma. Toxins which are accumulated in the larynx, pharynx, mouth, paranasal areas can evacuate through Nasya Karma. So this is Vamana Karma. Vamana Karma, especially for the kapha predominant disorders. So the Vamana is MS is the procedure, eliminate the waste products and toxins of the body through upper passage of by vomiting. So we are using Madanapala, that the Kukulmuan, all those things to evacuate these toxins, that the upper GIT tract toxins, even respiratory tract toxins can evacuate through Vamana Karma. So this is Virechana Karma. Virechana Karma, especially we are using for middle GIT tract disorders, Pitta predominant disorders, and even liver, gallbladder, and pancreas disorders, toxins, we can evacuate through Virechana Karma. So next, Vasti Karma. So Vasti Karma, especially for the Vata disorders, and it helps to control the lower GIT tract nervous system also, and evacuate toxins from lower low abdominal area. Apart from Vastika, there are two types of Vastikarma, Uttaravasti and Adravasti. This is called Adravasti. We can use Uttaravasti for the kidney disorders or bladder disorders, even uterus disorders, for especially in the female. So the next one, Rakta Mokshana. There are several types of Rakta Mokshana karma. It is especially for the Pitta and Rakta, dosha. Commonly we are using leeches for the leeches for Rakta Mokshana karma. So these are some diseases. We are applying leeches in Sri Lanka, that the chronic disorders, chronic wounds, and then the alophagia. You can see here elephantitis and type of skin disorders. Here also, then this is, you can see this is psoriasis patient before treatment and after treatment, after leech application, what happened to the patient. Again, joint disorders, we are applying leeches for joint disorders. So summary, actually my topic is a lifelong health with Panchakarma. So this is the sloka to prove that thing. Dosha kadachit kupyanti dichalangana pachanai jita sanshodhanai etu nateshan punaridbhavan. If we apply Panchakarma, that means Shodhana Karma especially, that dosha will never aggravate. That means it gives complete cure. Why it is? Because that the Shodhana Karma helps to increase the immune system. It helps to increase the Ojo Bala. Immune mean, according to the modern medicine, we call Ojo Bala. It helps to increase the Ojo Bala. Then it helps to increase the Deha Bala. And finally, it rejuvenates the Sapta Dhatu also. So that's why Shodhana Karma give lifelong health to the person. So if you can apply Shodhana Karma time to time, definitely you can keep health lifelong. So that is the thing I want to highlight to you all. So if you can ask if you have any question. Before the question, I just want to tell a little about myself. I am Chithramala Dissanayaka. My university is Gampaha Wickramarachchi University of Indigenous Medicine. It is the first indigenous medical university in Sri Lanka. So we very recently started. Earlier, we came under University of Kelaniya. So I am the Dean of Faculty of Indigenous Social Sciences and Management and Senior Lecturer, Gampaha Wickramarachchi University of Indigenous Medicine. I'm working as a Panchakarma consultant, Gampaha Wickramarachchi Ayurveda Teaching Hospital, Sri Lanka. And Dr. Deepika also may don't know, I'm a military rank major, Medical Corps, Sri Lankan Army Volunteer Force, and work as a university medical officer also. I work as a visiting lecturer of each and every university in Sri Lanka. I'm in Colombo, Jawadanapura, Kelaniya, then Jaffna, Trinco, and everywhere. So my academic qualification is I got my basic degree from the Institute of Indigenous Medicine and Doctor of Medicine from Banaras Hindu University, India. And I'm a diploma yoga diploma holder. It's from Banaras Hindu University, Varanasi again. So my research, I am awarded by so many awards. So these are some awards I have mentioned here. Vice Chancellor's Award 2020. Researcher with highest number of publication in Index Journal, University of Kelaniya. Vice Chancellor's Award 2020, again, Outstanding Senior Researcher, second place, University of Kelaniya, Sri Lanka. This is my Google Scholar research and ResearchGate. If you click here, you can see I have published more than 86 research in the ResearchGate. This is my ResearchGate account. You can see 92 publication and 16 citations, and these are my research. So that is a little about myself, and these are some workshops I have done in Tokyo 2014, then Tokyo 2015, and Tokyo 2016, then Nagano 2017, Tokyo again 2018, Sri Lanka 2019. This is my, again, military career. So thank you for listening those things also. So now the question round, Q&A round. I may be a little bit fast because due to the time limitation, but if you have any question, you can you can ask from any time from me or contact Dr. Deepika, and I am always ready to give the answers. So any questions?
Thank you, Dr. Chithramala. I think Marco has a question. Dr. Chithramala, can we ask you to take the screen share off?
You want to stop screen share, isn't it?
Yeah. Yes, please. Yes. Perfect. Thank you. And Marco had the first question, I think.
Hi, thank you so much. Super interesting. I had a question about the liquefying of the toxins and how you would do that on a day-to-day basis so that you can maintain this on the sort of a level, so you don't, not to avoid doing Panchakarma, but to aid in keeping your health well.
Yeah, actually, it's a good question. I said there are the toxins, we can divide it into the solid toxins, water soluble toxins, and then the fat soluble toxins, like that. So water soluble toxins you can evacuate through urine and then the sweating. So if you can do something if you feel you want to evacuate those toxins, you can do Swedana Karma. Swedana Karma means you can do the exercises and hot water bath, and then Langana Karma also helps to get sweating. Even you can that fat soluble toxins can burn by Langana Karma. So then the solid toxins. So that stool is the media, that the mala, stula mala, stool is the media to evacuate this solid toxins. If you can evacuate that stool properly daily, at the appropriate level, it helps to evacuate the solid toxins. So then gaseous toxins, that means through respiratory system and through lower GIT tract level, you can evacuate that gaseous toxins. So breathing exercises is very much helpful for you to evacuate those toxins. So those are the ways you can evacuate solid toxins, then water soluble toxins and fat soluble toxins by using Langana therapy. Fat soluble toxins and gaseous toxins by day-to-day life.
Can I add something, Dr.
Yes, sure.
Then, you know, I know you're living in another part of the world. I'm living in this part of the world. You know, I know what they're doing in here. You know what we're doing in there. You know, and the Marco, you know, you might have heard of the oil pulling. You know, like you have coconut oil and water and mixing with, you know, pulling in here and there, in a, like we call gandusha, you say. And then this is here is very popular, the oil pulling. But the thing is, the problem is, if you don't know about the limitation, they do overly. And that means instead of having all the toxins, they draw the initially whatever the nutrition as well, the best part. And that means you have to always do is knowing the limitations and how to do that. Otherwise, you know, nasya, the other one, you know, you can use the neti pot or the oil, you know, like you know, nasya, you know nasya is this kind of thing. Also, you can use to excrete the fat soluble toxins. And same times, you know, like here, you don't know Chithramala, here people use a lot is the enema, like coffee enema, urine enema, and then this enema, this anything you putting into the button, taking the stuff out. And that is the practice in here normally. And because they think anything you can put inside and you can get the water soluble, fat soluble toxins. But the thing is, the danger of that, not knowing doing that, is can evacuate the necessary mala. This Ayurveda says mala is to look after as well. You know, mala has to excrete all the mala. You know, some kind of this rajakshma, the disorder they call, mala has to be protected, because otherwise all the strength can go with the mala. And that means there has to have a limitation, and then this knowledge how to evacuate the toxins. And otherwise, but this little knowledge from Ayurveda bring into the West normally by some people who have little knowledge, and they introduce this kind of neti pots, and then oil pulling and enemas, and then even oleations, and then the kind of other form of swedana kind of thing, other form of detoxifying method. But there is a danger in there as well without knowing you do that. Am I correct, Chithramala?
Yes, definitely.
Yeah. That's kind of answer to that as well. I have to a little bit add something to Marco.
Yes. We had experience, you talked about experience in the clinic of patients having Panchakarma demanding that they have because they believe the enema is good, or Virechana or Vamana, and coming back very depleted in the energy afterwards. It had counter effects.
As a doctor, you have to recommend, or the practitioner, you have to recommend what kind of detoxification has to apply and how would it apply. But the thing is, here people is a lot of had the kind of obsess about the detox method, and they demanding us, can I have a 21-day Panchakarma? Can I have all the toxins removed? But these kind of toxins, the method of removing toxins has to be done with the correct Ayurvedic personnel who knows about how to do it properly. Otherwise, you deplete your bala or the ojas and everything, and then you're more prone to have some kind of disease, is it?
Yes.
Yeah. Yeah.
Then there is another question.
Yes. Thank you, Marco. And
Sinead?
Hi, Dr. Deepika. Hi, Ajanta. I was your first student, one of your first students, and then
I remember.
Nice to see you all, and thank you. And I've been trying to get through actually.
Yeah.
But you touched on it, Dr. Deepika, which was on the obsessiveness or the excessiveness of detox, and that was going to be my question, but you sort of answered it. How regular should one be doing it? But also in the Western world, we're very undernutrified because of the sort of diet we're eating anyway. But even for what's deemed as organic or what have you, there's too much pollution, too much, our ecosystem being messed up. And so we're so undernutrified. If we were to do the Panchakarma, like you said, it would have to be supervised by a professional. Otherwise, we could do more harm than good, especially with the fat-soluble toxins, which could, I believe, cause a lot of stress onto the liver, right? So how do you balance that, even if, because I'm really promoting Ayurveda, how do you promote in the Western world nutrifying the body first and then detoxing? Is my question. I think you've sort of answered it, but I would have liked to see, do we do the nutrification first or do the detox first? And if it's the detox, which part of the detox should we start off with first?
Yeah, I think we both can, those two can go simultaneously, because what happened, we are doing Virechana Karma, especially we can apply Virechana Karma for the that imbalance of fat condition. I mean, maybe patient having high cholesterol level, like that type of maybe disorders, or that obesity patient. They don't have high cholesterol or anything. Maybe that person is only obesity or a liver disorder, fatty liver, like that type of. Especially fatty liver and cholesterol condition, we can use Virechana Karma. Because scientifically it has proved that Virechana helps to get reduced the blood cholesterol, because Virechana especially act on the Pitta. That means Pitta we can correlate with bile. So when Pitta, that Virechana drugs helps to stimulate the gallbladder. When the gallbladder stimulate, that the bile comes from the liver to gallbladder. Comes from liver to gallbladder. So then the bile means to create the bile, that the blood cholesterol has to convert to the bile. So when did you get my point? The bile, or how bile create? Bile create from the blood cholesterol. So when that Virechana helps to Virechana helps to increase the when Virechana helps to stimulate the gallbladder, then when gallbladder stimulate, that bile used to come from the liver. So liver has to produce more bile. So to produce more bile, that the cholesterol has to break down. Blood cholesterol has to break down. So what happened? Then the blood cholesterol getting down to create the more bile, because Virechana helps to stimulate the gallbladder. That is the pathway. This is one pathway. So then the Virechana helps to maintain the fat metabolism, that the Meda Agniya, balance Meda Agni, because of deteriorate Meda Agni, that the fat accumulation can happen inside the body. So we need to correct the fat Meda Agni. Then only Meda Dhatu can balance. So before the Virechana Karma, we are using Sneha Sweda. Before that, we use Deepana Pachana treatment. So all the series of this treatment helps to correct that Medagni Dhatu. And Virechana Karma helps to evacuate these toxins from the body, as well as correct the Medo Dhatu Agni.
So what about in the case where someone like me who doesn't have a gallbladder, and it's very common, especially in the West, a lot of, as soon as anything, a little stone takes place in the gallbladder, it's, oh, we yank it out, and I'm one of those people. And so many people are also having surgeries now with the gallbladder.
Yeah, actually, that Virechana procedure, not only for it's to stimulate the gallbladder, it helps to stimulate the pancreas as well as liver. Okay, so gallbladder, actually, why gallbladder? Gallbladder only to store the bile. Gallbladder not going to produce the bile, only for store the bile. So Virechana drugs helps to stimulate the pancreas as well as liver also. If you get the Virechana drugs, it stimulates the liver and helps to convert that cholesterol to the bile, and it allow bile allow come from liver to main tract.
The first procedure has to happen first. You think, like the dhatus. We have 7 dhatus. Each dhatus, there's the Agni. And then the Medo dhatu and the, I will tell you in English way, then you can understand very quickly. With the muscles and the fat, in between that there's the Agni, the muscle has to become the fat, and there is the Agni. That stimulating that Agni can break down this fat, and that fat is bring into the blood, and then you can drain the gut, and then procedure what happening, like with the medicine, you can increase the Agni, increase the liver function, and then pancreas, and then bile forms, and then you can evacuate the toxins like that. Is it, Chithramala?
Yeah, even sweating procedures also helps to evacuate that underneath skin fat.
Yeah.
That those fat helps to evacuate by sweating mechanism, no? Swedana karma.
Yeah. And there's so many factors are there to help to evacuate the toxins, not only depend on the gallbladder. And that means that's what is the Panchakarma procedure is the much effective procedure, because we are not dependent on one fact, and we create in a lot of, we stimulate in a lot of places to dislodge the armor, pray into the gut, and evacuate through the immediate external doors. That's what we do. Okay, is it right? Is it? Yeah. Yeah.
Thank you.
Okay,
Thank you, Sunay. And Kiran has a question. Are you there, Kiran?
Yes, always. Hello, it's so nice to hear your voices, and really, really, really refreshing to see the lectures again from, the doctors here. And thank you so much, Dr. Chithramala, to basically be entertaining us, especially at this time. I've actually got two questions. It was just basically piling in my head. The first one, I think I know the answer, but I just want to double check. When in India or Sri Lanka, when you offer a Panchakarma treatment to a patient, would you be, so for a patient who's very, very weak and the digestion is very weak and their strength is very weak, would Panchakarma be still the first line of treatment over there? Is that something, or would you basically, because I know over here what Dr. Deepika has taught us, I just wanted to understand how you do it back there.
Yeah, if the patient is weak, as a first line of treatment, we can't do Panchakarma because it has mentioned us not to do for the weak patient Panchakarma. So first we have to do the Samana therapy to get that strength to the patient.
Yeah.
So after applying Samana Karma, then only we can, if the patient is come to the normal level, then only we can go for the Shodhana Karma.
Okay. Yeah.
And Kiran, if you go to your notes, dosha khajati kupyanti jita langana pachanam. Langana pachana, the shamana treatment. First you have to cut the branches. You can't uproot the tree. And then, then you have to do that. Especially the tree is really weak, and then we have to cut the branches and pull the tree out of the thing. But it's like the thing is in here, no matter what we're saying, people push us for the Panchakarma. And that means we have loads of argument with the patients. They spend all money. They want to spend all their money to get the 21 days Panchakarma from us. We say no. And they say, why are you giving all the money? Why you say no? I thought, no, we have to do it in a stage by stage. And then you have, because it's like, if somebody is only focused in money, and they would do that. And that's what when you go to India or Sri Lanka, in like that kind of conditions, people looking for the answers, they go and they have, here we go, I have 2 weeks in my diary, can you do the Panchakarma? Then they are really weak. And then because the money factor, India, Sri Lanka, that's fine, okay. If you, not Chithramala, Dr. Chithramala, if you go to the people who is only focused about money, they will do the treatment. And that means the patient will come back more deteriorated than ever. And then the bad name for the Panchakarma, like, because they do it in a different context, is it?
Yeah. That was it. I just wanted to double check. Thank you so much.
And you had another question, Kiran?
I do, but I'm going to be told also, but I still ask. In a country like UK, of course, with the lecture that Dr. Deepika has said, we know that what should be the gentle detox that we should be carrying in terms of diet and lifestyle. But Dr. Chithramala, according to you, a country where basically considering the weather in the UK and everything, what would you recommend as a gentle detox for when you see a patient who's got a vata imbalance or a pitta imbalance or a kapha imbalance?
Yeah, actually, if the patient is in vata imbalance, so we can easily apply Virechana Karma, isn't it?
Okay.
So even no need to go for the Vasti Karma, because Vasti Karma is a little bit difficult for apply. That means you need to maybe you want to get a help with doctor. So Virechana Karma. So Virechana karma is good for the pitta and vata condition both. So it's very easy to apply Virechana karma. A very simple medicine we can get for the Virechana karma. Is it so, Dr. Deepika?
Yeah. It's like Datri, is it?
Dhatri, yeah, I thought
You
so.
can use Datri, you know.
Yeah, Sukumara, Tripala, Manibhadra, Dhatri, whatever the thing.
So, yeah.
Only it's very easy.
Yeah, Triphala,
So,
you know, like daily.
Daily.
Triphala has, you know, like
yeah.
that's what people have daily, Triphala tablets, you know. But especially Vata people, you can see the imbalance is when the imbalance comes first, one is affected to Apana Vata, they're not going to toilet. And that it says, you know, Virechana karma is the one to apply, you know.
Yeah, yeah,
Yeah.
perfect. Yeah, because I think when we get patients here in the Western world, in India, I think the way they treat the doctors is like God. But here, when you actually see, they actually treat you as a body that they can ask you 1,000 questions. So I'm getting few patients who are like, so why are you not giving me detox? Why are you not giving me this? So I've actually given them like I've got few, of course, high pitta people. So I've given them proper lectures about Dhatri and Triphala and everything. But I was like, okay, let me see if I'm actually on the right track. So yeah, sounds good. Thank you. That was all.
What you're searching for, you already have, Kiran.
Yeah, the Kiran is Dr. Chithramala doesn't know about Kiran. Kiran is already finished 2 years ago the course, and she's professionally she's a scientist now. She's doing Ayurveda as well. Yeah.
Nice to
Yeah.
hear.
Yeah, that's why the tendency to ask questions, Dr. Chithramala. Yeah.
Yeah. Well,
Thank you.
Thank you, Kiran.
Sure.
And Marco, you had another question?
Yeah, I did. Thank you. I wanted to ask. So I've been doing the cumin and honey, and my wife Nigella seed and honey before, twice a day before dinner, and as part of the Agni Deepana process. And I was wondering, is there a limit to this? So what you can, how often is it? Is there no limit? Because this will help, obviously, on the long term. It should help balance the Agni, right?
I will explain to Dr. Chithramala about a little bit. Cumin and honey doesn't regard, you know, Suduru Mipani, you know, and not regard as a quite big medicine in Ayurveda. Am I correct? It is
Yes.
like a normal kind of prevention kind of method of application. It's not about like Triphala or Dhatri or some other big medicine, you know. And then am I true? You know, like if you give the Sudru and Mipani, you know, like the cumin and honey, people who suffer from lower kind of minor digestive issues, you see, they're not given to the major digestive issues in Sri Lanka. I think that is the correct answer for, I don't know, because Dr. Chithramala operate in a hospital level with the big, doctors and with medicine. But here, the first year students, they allow to give a practice with the cumin and honey, some Triphala, and some kind of the minor kind of medicine. And then when you upgrade to second year, after second year, they can have the Dhatri and Hinguastaka, this kind of formulated medicine. And then the Marco asked the first line of medicine, what he's taking, and he and his wife, is that any effect on their long term? Is that effect on their digestion? That is the simplify the question for Chithramala, Dr. Chithramala. Okay. Yeah.
Because there is a word called that verse called Samanya Mekatva Karam Visheshatva Pratakara.
Yeah. Yeah.
So,
You can explain.
yes. So every day getting that even that those are that food materials. Okay. But drugs, maybe some little amount of drug, it can that even that cumin also get more and more that large amount, no?
Yeah.
not the small amount. If it is large amount, it can create problem. But the small amount, it's okay. It's just like work as a food.
Yeah.
Is it so, Dr. Deepika?
Yeah, and it is not. And anyway, if it is the patient is very much aligned with or with their sign and symptoms which body occurs, and you can go to the you can watch yourself. It is that okay, or it is that enough or not, or do I have to stop this medication now because it is like given me some kind of different effect? And that way, any herbs, even coriander water, and
Yes.
is a shita kasha, because it's Dr. Chithramala here, that I mean, is coriander water and cumin and honey. People here can get every day because their diet is wrong, their digestion is wrong, and
Yes.
the accumulated toxins levels are high.
Yes,
And
true.
in Sri Lanka, we can't do that because cumin and honey, we put into curry a lot,
Yes.
and top of that, we have cumin and honey, we definitely have adverse effect.
Yes, yes.
And
That's true.
here, we don't, most of the people not eating curry. Even if they're eating curry, there is like not like the way we making curry. Yeah.
Yeah.
And that mean, I think the Marcos to the answer is, I think it's not that bad. No, especially when I see you how you eat when you're in between the,
In the classes.
class, and your digestive is so high and you digest food quickly, and then there is imbalance occurs. It can sort it out with the cumin honey, and it can, long term you can use it. And even some patients who comes to us, the coriander water, after 5 years later, I asked, you have to carry on coriander water again, and the patient saying, no, I didn't stop. That means they can carry on coriander water for 5 years, because as long as they have accumulated heat in the body, the coriander water would help. Busy. Yeah. Yeah, that's okay. You can carry on cumin and honey.
Unless you're Indian.
Unless you are Indian.
You get it.
Your wife is definitely not Indian. That means, you can carry on.
Thank you.
Thank
Mark.
you so much.
Okay, Marco.
And Sarah had a question. Where are you, Sarah?
I'm here. Hello. Hello, Dr. Deepika, Dr.
Hi,
Chithramala.
Sarah.
Hello, just a very short question, really, I suppose. I'm trying to think of the words for the question. So Dr. Deepika has taught us an amazing massage treatment regime, which includes hot oil massage with medicated oils, followed by Marma therapy, chakra balancing, and finishing off with Pinda Swada, which is like magic, I'm finding. And in fact, the more I do, the more magical this treatment seems to be. And it just amazes me every time what happens to these people when they go from my room. And I'm aware that as practitioners at this level, we probably won't or may not ever be able to do some of the, these Panchakarma procedures, without significantly more training. And I'm just wondering how that treatment, or is that treatment almost sort of doing what Panchakarma is doing in the UK, because it just seems to shift so much for people, and it seems to have quite a lot of the I've done some Vasti treatments. I haven't done Shirodari yet because I'm a little bit worried about that, but it seems to have quite a lot of the Panchakarma elements to it. And I'm not quite sure what I'm asking actually, but I think I'm wondering, is what we're doing with the massage therapy kind of our way here in the UK to get as close to Panchakarma as we can as practitioners? or is there more training we can do? I guess. But I mean, what we've learned already is just like magic. It's an amazing thing.
Funny, Sarah, you know, you're talking about that. Me and Dr. Chithramala have yesterday a very big discussion about how the Panchakarma, how can I train the people with Dr. Chithramala, how can we send them to Sri Lanka? Because it's like here, it is like, you know, you need to have a group of people rather than one by one, because it's like it had to be with a diet, and it need to be having, you have to have a relaxed environment. You'll be able to experience Panchakarma, same time you have learning Panchakarma. Then we discuss about how we can do it, you know, but it's in a pipeline. We talk about that. And then other question, you know, you asked from Dr. Chithramala, you know, you can answer Dr. Chithramala about
Dr. Deepika, I didn't get actually
effect,
that question.
yeah, effect having the hot oil massage and the Pinda Sweda, some form of you know, Swedana, you know, and form of evacuation things, you know, given Datri or something. It is having similar effect like Panchakarma, or less effect, or you can enhance the therapy more to get more effect. That's what the
Yeah.
is that correct, Sarah?
Yes, I think so, because I've often wondered if with my clients as they come through, I should not go straight in for the massage therapy and sort of say, look, let's do a few, you know, few weeks on the herbs and the diet and everything first. I'm wondering if also then that makes my massage treatment even more effective, because the body's already started to work on the elimination and agony, so it's almost even more ready to receive, you know, the magic of the oils and the treatment.
Yeah, actually, that the massage therapy, especially oil massage therapy, I'm not even dry massage also helps to stimulate the nervous system and stimulate the circulatory system. So when the nervous system and circulatory system stimulate, what happened that then that throtas get open, the channels get open, and more nutrient can goes to that specific area, that the massage area. So what happened that nourishment has enhanced, and meantime that the toxins can evacuate from that side. Means if the circulation is get improved that local area, what happened, nourishment goes that the circulate, that means blood, arterial blood, according to the Western medicine, arterial blood goes that circulation improve towards the local area, and venous circulation also meantime improve. So toxin get evacuate from that area, meantime that the nourishment also same thing happen. So that means through massage can stimulate circulatory system, nervous system, then the lymphatic system, and even that the fat metabolism can increase, because that the when we are doing massage, we need more energy to that local area. So to get the more energy, that area fat is getting burned. So 3 or 4 things happen. Meantime, when we are applying Pinda Sweda, actually Pinda Sweda is help to nourish that nervous system. Then the evacuate toxins. It helps to nourish that area and nervous system also. That is the special feature of Pinda Sweda. So that's why I said Panchakarma not only for evacuate the toxin, but also for the nourishment purpose we can use it.
It's very interesting you should say that, actually, because most of the magic that's happened after the massages has been the deep emotional stuff and mind things, and you know, some really amazing healings have gone on when they've gone away, or in the room itself, but it's mostly, and I suppose it's because we're in the UK as well, and we're all very, you know, mindy, and I've got lots of suppressed emotions, but that seems to be what's happening. Is it's very emotional healing, as physical as well, but lots of deep emotional stuff coming out. It's quite amazing. So I really want to learn more and more and more. So
actually, when the massage is doing, it is not affected only physical part, that the psychological part also getting affected. So that the therapist should be in a psychologically free and free mind and everything. So then only can psychologically can deal with the patient also. Is it so, Dr. Deepika?
Yeah. Yeah, you're correct.
It's a very interesting part.
Interesting part. Yeah, Dr. Chithramala said to me, you know, like, because it's like when we discuss about this Panchakarma therapy, and then Dr. Chithramala said, hey, you know, that what you say, that dharmartha kama moksha, the moksha, you know, some people in a samsara is going through whole way through. That's the exit button. So you can go out of the moksha, you know, like it's with a lot of work. And Dr. Chithramala said, hey, if somebody asks moksha, you deal with. I deal with the samsara. I want to stay in the samsara. That's our deal is. We had a laugh, you know. I still enjoy my food. I still enjoy my clothes. I enjoy my life. And I want to stay in samsara, you know. And it's like, if it is exit button, you press you explain to your student. I'm not going to deal with that. That's our deal. It's interesting, you know, because you know, like, either you deal with or not, is it Dr. Chithramala? It is coming, you know, like that's what Dr. Chithramala is saying. The therapist and the doctor had to be geared up with the, you know, equipment to deal with the patient. Is it?
Yes.
Yeah. Okay.
And
thank you.
Yeah.
And I think Christine just wrote a message in the chat saying there's research to show that we have actual molecules of emotion and they're held in the fat tissue. So when we release fat soluble toxins, we would also release the emotion.
It is research, yes.
That's some research, yes, she said. But thank you, Sarah.
Thank you.
And I'm
so pleased to be doing it.
And I think this is a good moment to wrap up. So I'd like to say thank you to everyone for coming and participating. And thank you for great questions. And a very big thank you to Dr. Chithramala for her time. I know it must be quite late now in Sri Lanka in the evening, in the night. So we really are very grateful for the time you've taken and effort.
Yeah, thank you, Dr. Chithramala. And again, you know, stay connected with us. People need a lot of knowledge in here to do, you know, stay in health and happiness, you know, when they in a lay life as well. And if you want to have moksha also, there is if you have to maintain the physical body, maximum health and optimum health, and psychology will open up to some kind of, you know, other areas then, is it? And that means we need this knowledge from Sri Lanka and India to this country to help people how to deal with their health and happiness and their moksha as well. I have to say that. Okay.
Can I just ask quickly then, would it be proper, would it be right to say, if like in trying to get this whole, the alternative therapies as they call it, but especially in Ayurveda, would it be right to say, from what we've just discussed now, that if we want to get our emotional health, just get a Panchakarma? Can we say that without having, and then later on maybe discuss and say, okay, before the Panchakarma, you obviously need treatments and strengthening and what have you. But would it be a proper, I'm trying to find a way of making it hit home, where people can actually connect this whole detoxification with mental health?
Yeah, that I will tell you that, because it's like there is a two malas, but we're not talking about the other malas, like the physical mala. Dr. Chithramala explained everything, and Mano has taught us Mano armor. There's a lot of things is a heart and mental, in between that channel. There's a lot of residuals. So these deposits of Mano armor, unprocessed thoughts, and yes, the Shirodhara, head massage, these kind of things help to remove that, unprocessed thoughts. And the Udanavata is stimulate, and then you vocalize, you cry, you do everything to expel that emotions you have. And that means, yes, you can have that treatment to enhance your mental health as well as the physical health.
Shirovasti even, no?
Shirovasti even, yeah, Shirovasti, yeah. Yeah.
Thank you.
Okay.
Okay. Well, thank you very much for everybody, and have a nice evening. And thank you so much to
Dr.
Chithramala.
Chithramala. Okay,
Thank you, you all.
Thank you.